All right, welcome to The Explainer. Today, we're diving into a medical mystery that kicks off with a really common symptom, fatigue. But trust me, it leads us to a fascinating paradox deep inside the human body. We're going to piece together all the clues to really understand chronic anemia.
So, let's start with this question right here. It sounds completely backwards, doesn't it? Your body has all the iron it needs, but it just won't use it to make red blood cells? Now, this isn't just some hypothetical puzzle. It's the core reality of a condition we call anemia of chronic disease.
Every good mystery needs a starting point, and ours begins with a patient's story. It's a complaint doctors hear all the time, but in this case, it's a signpost pointing to something much, much deeper going on.
So let's meet our patient. She's a 55-year-old woman, and for the last 5 years, she's been dealing with rheumatoid arthritis. The reason she's here is this fatigue that just keeps getting worse, to the point where it's really affecting her quality of life. Now, what's important is that all the usual suspects are ruled out. There's no bleeding, her diet is fine. So you have to ask, is this just her arthritis, or is something else at play? To figure that out, the investigation begins with a routine but incredibly powerful test, the complete blood count, or CBC. This is where we get our first solid clues.
Okay, the lab results are back, and right away, you can see her hemoglobin is low, 9.3. That confirms it. She's anemic. But here's where it gets really interesting. Look at the MCV and the MCHC. These numbers basically tell us about the size and color of her red blood cells. And what's wild is, they're totally normal. The cells themselves look perfectly healthy.
This pattern has a specific name, normocytic normochromic anemia, and it tells us something crucial. It's not a quality control problem, it's a production problem. The factory is making great red blood cells, it's just not making nearly enough of them. And that low reticulocyte count, which measures brand new cells, confirms it. The production line in the bone marrow has slowed way down.
So, why is the factory slowing down? I mean, the most common reason for a production slowdown is a shortage of raw materials. For red blood cells, that key material is iron. But when we check our patient's iron levels, this is where the mystery takes a really strange twist.
You know, the #1 cause of anemia in the entire world is just plain old iron deficiency. Your body just doesn't have enough. So could that be the simple answer here? Well, let's see what the tests say. In your textbook case of iron deficiency, the labs are pretty predictable. Iron in the blood, low. Ferritin, which is kind of like the body's iron warehouse, is also low. The stores are empty. And because of that, the total iron binding capacity, the TIBC, is high. The body is basically sending out a fleet of empty trucks, desperate to grab any iron it can find.
But our patient's results? They flip this completely on its head. Yeah, her serum iron is low, just like you'd expect. But look at her ferritin. It's sky high. Her iron warehouse isn't empty, it's packed to the rafters. And her TIBC is low, which means the body isn't even looking for more iron. This is the iron paradox. There's barely any iron in circulation, but tons of it locked away in storage.
Okay, so this paradox, it's everything. It is the absolute key that unlocks this entire diagnosis, and it points a finger directly at the mastermind behind this whole situation.
And the culprit is a powerful little hormone called hepcidin. It's made in the liver, and its job is to be the master regulator of iron in the body. And in our patient, it is basically gone rogue.
So, here's what's happening. Her rheumatoid arthritis is creating this constant, low-level state of emergency, chronic inflammation. Her liver sees these distress signals and reacts by pumping out tons of hepcidin. Hepcidin then acts like a security guard on high alert. It locks all the iron away in storage cells and slams the gate shut on any new iron coming in from her diet. The iron is there, but it's on total lockdown, completely unavailable for making new red blood cells.
And this isn't just about RA. This exact same process is why people with chronic kidney disease, certain cancers, and long-term infections often develop this very specific kind of anemia. The underlying inflammation is always the trigger.
All right, let's really nail this down. We're going to put these two conditions side by side, because seeing the key lab differences is what makes the diagnosis, and getting it right is absolutely critical.
This chart just lays it all out so clearly. Notice how serum iron is low in both? That's why you can't rely on it alone. The real tell, the dead giveaway, is the opposite pattern in the other two markers. For anemia of chronic disease, you see a low TIBC and high ferritin. For iron deficiency, it's the exact opposite, high TIBC and low ferritin. That's the distinction that matters.
So,
We've solved the puzzle. We've identified the condition. But you might be wondering, why is this so important? Why does getting this diagnosis right make such a huge difference for the patient?
Oh, it's a huge deal. First, you don't give the patient iron supplements. She doesn't have an iron shortage. She has an iron access problem. Giving her iron pills would be totally useless. It's like trying to deliver more packages to a warehouse that's already on lockdown. Second, it saves her from a whole bunch of invasive tests looking for a source of bleeding that isn't there. And most importantly, it puts the focus exactly where it needs to be on treating the root cause, her underlying rheumatoid arthritis.
So if there's one thing to burn into your memory from all of this, it's this simple but incredibly powerful formula right here. When you see high ferritin plus low serum iron plus a low TIBC, you are almost certainly looking at anemia of chronic disease. It's that clear.
You know, this whole case is just such a fascinating reminder that a seemingly simple symptom like fatigue can tell a much deeper story. It shows how our immune system, our liver, and our bone marrow are all in this constant, intricate conversation. A disruption in one system can cause these huge ripple effects in another. It really makes you wonder, doesn't it? What other hidden connections are just waiting for us to uncover?
Hi there, forest friend. Thanks for clicking on our video. We're so happy you're here. Before we jump in, don't forget to like, subscribe, and share this video with your friends.